just get the formalities out the way. Can I just confirm your name, please? Great. And can you confirm your date of birth? That's great. And can you confirm your address, please? That's great, thank you very much. Okay, so basically a cranial nerve examination in layman's terms is just, we're going to check all your senses. So we're going to check your eyes, we're going to check your ears, we're going to check your nose and your mouth, and just going to check all the nerves and make sure that everything is working correctly. Is that okay? Have you got any questions before I start? No? Okay. So, firstly, I'm just going to have a look at your face. So if you could just look at me, thank you. Okay, so everything is symmetrical. That's great. Okay, so first of all, I'm just going to put my gloves on, okay? Okay, so first off, we're going to start with the olfactory nerve, okay? And that basically is just your nose. So it just transmits information, sensory information, from odours going into your nose. So everything, can you smell everything at the moment? Everything seems normal. Okay, so we're just going to try that out. So I've just got 3 little bottles and they have 3 different scents in. So if you could just tell me what they are when I put them under your nose. If it helps, then if you want to close your eyes when you're smelling it, then sometimes this scent is a bit stronger. Okay, so this is the first one. Okay, so I'm just going to put it under your nose and you let me know what you think it is. Take a good whiff. So, what do you think that one is? Peppermint, that's great. Okay. So, just the second one here, okay? Okay, so I'm just going to put this under your nose and you tell me what you think it is, okay? So, what do you think that one is? Lemon. That's great. Okay, just this third one here. Okay, I'm just going to put this under your nose and you tell me what you think it is. Lavender, that's great. Well done, top marks. That's great. Okay, so all good for your nose. Okay, so now we're going to have a look at your eyes, okay? So just sit and be comfortable there, and I'm just going to check your eyes. I'm just going to have a look at your pupils, make sure that everything is symmetrical and as it should be, okay? So you can either choose a point on the wall or look at the chart behind me, and I'm just going to have a look at both eyes, okay? a look at this chart just behind me. Can you see which line you can see most clear? And if you could read it out for me, please. That's great. Okay, no problems there. Do you think you can do the lower line underneath it? That's great. Wonderful. Okay, so we're going to just check each eye individually now. So if you could cover one eye as you do it, and we're going to do it again, okay? That's brilliant. And the one below. Okay, that's great. Wonderful, you're doing great. If you can just swap eyes, and we'll do the other eye now, okay? Yep, put your hand over the other eye. Great. Okay, see if you can do the same. Okay, is that one a bit more difficult? Right, okay. So it seems that you've got one stronger eye than the other, but that's absolutely fine. And, you know, some people have glasses. Yeah, great, you do have glasses. Okay, that's absolutely fine. If you have glasses for watching television and driving, then that's absolutely fine. I will tick that off. Okay, so what I'm going to do now is, as you're looking at the chart, if you can just cover one eye again, and I'm going to just check your pupil reflexes. Okay, while you're looking at the chart, that's great. Thank you. That's fabulous, well done. Okay, and then if you could swap eyes, that's it. That's great. Now I'm going to just go check the other eye now. That all looks great. Okay, and then uncover both. That's great, and I'm just going to check both. And one more. That's great. Okay. Okay, if you could just look at the chart, and then if you could just then look at my finger. That's great. And if you can look at the chart again, and look at my finger. That's great. And look at the chart, and then my finger. That's great. And then the chart again, and my finger. Wonderful. Okay, if you could just focus on my nose. Yeah, that's it, look at my nose. Okay, and then can you see my fingers wiggling? That's great. Okay, now focus on my nose still, and if you could tell me which finger I am wiggling. Fabulous, that's great. Focus on my nose, and then which finger am I wiggling? Fabulous. Focus on my nose again. Thank you. Which finger am I wiggling? That's great. Thank you. Focus on my nose again. And how many fingers am I holding up? That's great. And one more. Focus on my nose, and then how many fingers am I holding up? That's great. Fabulous. Okay, if you could then cover one eye again, that's it. And then I'm going to bring my finger into view, and you tell me when you can see it, okay? That's great. Okay, and then swap eyes, and we'll do it the other eye. That's great. Okay, that's fabulous. Okay, and then if you could just focus on my nose again, and I don't want you to move your head, I just want you to move your eyes, and I want you to follow my finger with your eyes, okay? That's it, keep your that's great. We're just going to try it with my pen. Fabulous. And then we're just going to go back to, if you could look at the chart, and then look at my pen. That's it. And then the chart, my pen, and the chart, and then my pen. That's great. Okay. Just one of your eyes, just a tiny little bit lazy as it's looking, but I don't think it's anything to worry about at the moment. So we'll just keep an eye on that, okay? Any double vision or pain when I was doing that? No, that's great. Okay, one more time with the torch. I'm just going to check your pupils' reaction to the light. So if you could look at the chart again, and I'm just going to check again. Okay, keep looking at the chart, thank you. That's great. Okay. No problems there. Okay. So all your eyes look like they're absolutely fine. Just that one is you can't see quite as good in the chart, but your glasses are there to help you with that, and you've just got one lazy reflex there that we'll keep an eye on for next time, okay? So now we're going to look at the sensory. So if you could just keep your head still, and I'm just going to hold your head, and you can tell me which side of your face you can feel me tapping, okay? So I'm just going to hold your face just like this, okay? And then you just tell me which side of your face that I'm tapping, okay? Are you ready? Yep, correct. Okay, and again. That's great. And one more. That's great, fabulous. No issues there. Okay, so I'm just going to check your jaw muscles. So if you could just relax your face to start with, and I'm just going to literally massage to check. And then if you could just clench your teeth together, that's it, and I'm just going to do the same. Okay, and if you could just open your mouth slightly, that's it. Okay, that all feels normal, that's great. Okay, and I'm just going to check one reflex. Okay, I'm just going to come close to your eye and... Okay, you didn't expect that. I was just checking that you were going to blink, okay? That's all fine. Okay, so now we're going to move on to the motor assessment. So, have you had any changes of your taste or your hearing recently? No, all been fine. That's great. Okay, so what I need you to do is if you could raise your eyebrows like this, as if you're surprised. That's great. Fabulous. All's fine and symmetrical there. Okay, and then if you could just scrunch up your eyes really tight so that you can't open them like this. Okay, that's great. Fabulous. And then if you could just blow out your cheeks like a puffer fish. That's great. Okay, wonderful. Fabulous. Okay, that's great. And then if you can do the biggest smile that you have ever done for me. Beautiful. Beautiful, that's great. Okay, well done. And then if you can try and whistle for me. So if you close your eyes, I'm just going to whisper into each ear, okay? 43. What number did I whisper? That's great, okay. And then into the other ear. 72. What number did I whisper? That's great. We're just going to do that again with another number, okay? 98. That's great. Okay, and again. 23. 23, that's great, okay. Any issues with your hearing? No? Okay. And then anything with your mouth, if you can just open your mouth and as if you're going to say ah with your tongue down, I'm just going to have a look in the back of your throat, okay? Ah. Have you had your tonsils out before? Okay, yeah, I can see they're not there. Okay. Any changes with your voice or anything with your cough? No? Okay. If you could just open your mouth again and say ah. Ah. That's great. And then if you could just cough for me. Fabulous. Okay. And then if you could just, I'm just going to get the torch, if you could stick your tongue out as much as you can, and I'm just going to check your tongue. And if you could put it to side. Okay. That's great. Everything in your mouth looks absolutely fine. Okay. That's great. Okay. So, I've done all the tests that I need to for the cranial nerve examination. Everything looks absolutely fine. Obviously we have picked up that slight issue of your eye, but there's nothing for me to worry about at the moment. It's nothing for you to worry about. So you just